Vaccination of sheep and cattle is a routine procedure carried out on New Zealand farms. There are many different types of sheep and cattle vaccines that farmers may use, but irrespective of vaccine type, correct technique is vital to ensure the best success from the vaccine used. We will outline the correct technique for subcutaneous or sub-Q and intramuscular or IM vaccination of sheep and cattle. This is the equipment required. Needles allow penetration of the skin into the muscle for IM injection or into the space between the skin and underlying tissues for sub-Q injection. Use 18 gauge short vaccinating needles. A syringe or vaccinator gun is used to deliver the correct dose of vaccine into the animal. The draw-off tube connects the vaccinator gun to the VaxiPack and the vaccine. Traditionally, a single needle and syringe were used to draw up vaccine and administer to the animal. It is now routine to use a vaccinator gun attached to the VaxiPack. When using a vaccinator gun, attach the draw-off tube by piercing the rubber stopper of the VaxiPack. The rubber stopper should be pierced centrally, as shown, at the thinnest point. Piercing near the outer diameter of the rubber stopper will cause difficulty due to the thickness of the rubber in this region. Once the gun and draw-off tube is attached to the VaxiPack, squeeze the trigger to move vaccine through the draw-off tube until the vaccine is filling the barrel. Continue carefully until all the air is removed from the barrel. Attach a sterile needle to the gun, being careful to handle the needle only at the hub to prevent contamination of the needle cannula or shaft. This is easiest when using a small pair of pliers. You are now ready to vaccinate. Ideally, needles should be changed every 20 animals or so. As a minimum, change needles between packs of vaccine. Blunt or damaged needles can cause tissue damage and risk infection at the injection site, which can lead to carcass damage. Read the label carefully for storage instructions. Some Coopers and MSD animal health vaccines can be stored for up to 6 weeks after opening. To store a vaccine, gently remove the draw-off tube from the stopper and empty the tube and vaccinator gun by depressing the plunger several times. Disinfect the stopper with methylated spirits or similar disinfectant. Store the vaccine upright in the fridge in its original cardboard container and make sure the vaccine doesn't freeze. The guns, draw-off tubing and needles should be rinsed with water and then stored when clean and dry. This equipment must be sterilised prior to reuse. The key points to remember are: correct technique is vital to ensure the best response from the vaccine. Use the right equipment for the job and maintain sterility. Change needles at least between packs of vaccine. And follow label and storage instructions carefully.